This original WSRE presentation is made possible by viewers like you. Thank you.
Welcome to Pensacola State College Perspectives. This is a new year and we have a new name. This is a place where we'll take an in-depth look at ways Pensacola State College impacts our community. I'm your host, Patrice Whitten, Executive Director of the College Foundation. During the next half hour, our topic is Healthier Futures, and we're going to learn more about a new $8.5 million grant that's going to help make that happen, both for our economy, our students, and our college. Now we welcome Deborah Douma, Director of Institutional Research and Grants. Welcome, Debbie.
Thank you.
How did this happen?
Well, we heard about this opportunity this summer. It was brand new. It was funding that was received by the Department of Health and Human Services as a result of statutory authority from the new Healthcare Reform Act that was signed just last March. The Patient Protection and Affordable Care in Healthcare and Education Affordability Reconciliation Act. So nobody knew anything about it. It had not been available previously, and we put some heads together at the college to see if maybe it would help students overcome some of the barriers that we normally don't have funding available for.
Okay, so an overview of the grant, who is it going to help?
This particular funding will be available to help eligible students or prospective students that either need to be participating in the TANF program, which is the Temporary Assistance to Needy Families, or be at the 200% level of poverty. And we know that some of our current students are already going to fall within those guidelines, and we're going to try to help them in addition to helping prospective students, or maybe even there's some folks out there that have never thought about going to college before because they felt like they couldn't afford it, that this might offer them that opportunity.
In some of the reading, and there's been a lot of publicity about this lately, I recall reading the $1,000 number for the number of students to be helped, and this is over a 5-year period.
Yes, the minimum that we'll be helping each year is 200, but we really feel like that we'll be able to leverage other programs that the college has in place that are funded by both federal programs, state programs, in order to help even more students. And for this particular grant, the official name of it, we're calling it the Health Profession Opportunity Grant, but the official long name is the Health Profession Opportunity Grant to serve TANF recipients and other low-income individuals. So
that's an awful lot to remember, isn't
right.
it?
So we're just calling it the Health Profession Opportunity Grant.
Okay.
And the services that are going to be provided are education, training, and supportive services that are necessary to help these individuals actually enter and advance into employment in the health sector. So any position that would be considered a health profession they'll be eligible for any one of, if they're in any of our health profession programs.
And we also have here with us today Dr. Erin Spicer, who's the Dean of our Warrington Campus, where our health programs are housed. Welcome, Dr. Spicer. I wonder if you could give us a little bit of an understanding of the various programs or the health occupations that are going to be impacted by this grant.
Sure. We have about 25 health programs on the Warrington campus, ranging from some shorter programs. The CNA program, the Certified Nursing Assistant program, is about a 6-week program, to some 1-semester programs like the Emergency Medical program, all the way up to 2-year programs like the Registered Nursing program. And within all those programs, we have a sort of career ladder that the students can work through. For example, a student may start in the Certified Nursing Assistant program, move on to the Practical Nursing program, then to the RN program, then to even the Bachelor's of Nursing program. And they can do that in a variety of ways. That's just one example.
Yeah, so the real, I guess, focus of this, the real objective of this grant is to take someone who is living at the poverty level and to give them an opportunity for a new start in life, while providing services for their family, and for many other things which we're going to get into later in this next segment. So Dr. Keith Samuels is with us today, and Dr. Samuels is the interim director of this grant. Dr. Samuels, what from your perspective do you see as being the greatest impact on our students?
Well, this is an opportunity to eliminate barriers that as a college we typically don't get to do. You know, we can find scholarships, we can even find money for loans, tutoring, anything directly related to education. But our experience is that so many of the barriers are not educational barriers. Our students are smart enough to compete in the programs. It's life that gets in the way of their education, and that could be in the way of child care, a sick child, not necessarily ongoing child care. Could be something as straightforward as they go to the car, the battery doesn't work, and they have no way of doing that. They get behind, their lights get turned off. So we feel like that this is going to help with things such as transportation, child care, emergency services, things that the college is just helpless generally to do. And we feel like that by being able to do that, we're going to help students persist through their entire curriculum. And on, the grant's also going to help us get them job ready. So not only the educational curriculum, but job getting and job keeping skills. And we'll do that with some of our community partners as well, with the hospitals, with workforce and so forth. And we can follow them even as they get a job for the first 120 days to sort of help them get into that work environment.
A true career ladder as Dr. Spicer was speaking to.
Absolutely.
There was a situation that you were sharing with us earlier, Dr. Spicer, about a student who was attending the programs at the Warrington Campus, nursing in particular, I believe. You want to share with us the living conditions and how this student persevered regardless of the barriers that they were meeting?
Well, we've talked to lots of students who are facing all sorts of issues like Dr. Samuels mentioned, and we've had students who are coming to class with their lights have been turned off, they're unable to afford food to feed their children, or even we've had students who have been living in their cars as they finish the programs. And I mean, some of them do persist through, but sometimes those sorts of things overwhelm them and they don't.
So this is a retention opportunity for the college and will help our students stay in college, go ahead, as you say, and persevere through a career ladder situation where then after we're following them 120 days. And then what happens? Do we help them with placement? Is there an opportunity for that?
Once they graduate, or as they approach graduation, we're going to shift from college success skills as a parallel curriculum to job getting and job keeping skills. How do you interview? How do you do resumes? You know, how do you actually get out there? And then we'll also, the grant will allow us to buy the tools they need to go to work. So if they need stethoscopes, if they need uniforms, then the grant will provide those things as well. Then once they get on the job, we're going to have case managers who work with them as an ally to help them through the process. And that person then becomes a job coach during the first 120 days of employment, and we will continue child care, transportation, but on a decreasing scale. So from the time they get to work, get a job, we'll watch them for 120 days to give them a chance to acclimate and get into the workforce.
How are you notified, Ms. Douma, about the successful application, and how did you share that with your partners who helped put this together?
We actually received a call from the program officer in Washington, D.C., and that information is always shared also through the Senate offices. So we received a phone call from Senator Nelson's office and also from Congressman Miller's office. And I probably started shouting in the hallways before anything else. We were so excited because opportunities that are going to be afforded by this grant, we were fortunate that when they developed this grant through the Children and Families Administration, that healthcare jobs were the focus. that is an area in our community where students can get training and then get a job. If it had been manufacturing or some other areas, we wouldn't have even applied in the first place. But healthcare is kind of recession-proof. It's oil spill proof. That if you have that training, I think Dr. Spicer would agree, most of our students are placed. If they graduate from a program, they're going to get a job, and they're going to get a good paying job and have those career ladder opportunities. So we were fortunate that when they came up with this program, they picked the industry that we have in our area that would be a good one for students to get training in.
Dr. Samuels?
Patrice, I think one of the largest joys in this grant is this is not just a college grant. This is a community grant. And so I think as we wrote this, Debbie and I looked at this as being able to be sustained through the development of collaboration across the community. So I just really think this is going to be a part of our community for a long time.
Now, is there an opportunity to reapply after the 5 years duration of this grant? Do we get another opportunity, or will this 5-year period be it?
We don't know at this point. This is what they consider to be a demonstration grant because it's a first-time opportunity. It's not like some of the other federal grants that we have that we've been able to renew every 5 years. The Administration of Children and Families is also very excited about it. We had an hour-and-a-half long conference call with them on Thursday, and they are putting a lot of their own manpower and resources and other funding into evaluating what goes on. They're very interested in everyone being successful, so we certainly hope it'll open doors for other funding opportunities. But as Dr. Samuels just said, I think because we developed the project with the community partners in the very beginning. They were very responsive to us when we started calling and emailing and say, we have 30 days to put this huge grant project together. Can you all come to a meeting maybe day after tomorrow? They were there with us, and we're talking about the local hospitals, Catholic Charities, Early Learning Coalition, United Way. We have a very long list here of partners that were all very much instrumental in providing the information to us, because as Dr. Samuels said, we don't usually provide social services to our students, so we needed to talk to the experts to find out what needed to be involved, what did we need to request the funding for to be able to do that.
Truly a collaborative effort. When you talk about opening doors, I understand this will have positions.
Yes.
Actual employment for some of our area residents for which they can apply. Are those actively being
They are right
sought?
now. They are closing the end of this week, and we'll be going through the normal processes for hiring. But in addition to that, because of the dollars that will be going out into the community as subcontracts, I think there might also be some opportunities that social agencies that actually respond to any bid, we do have to do fair and competitive bidding for those contract positions, that there might be more opportunities for employment even beyond that when those dollars hit the community.
So I'm a student watching, or a parent of a student watching, and I would like very much to get support from this grant. Who's my first call? Where do I start?
Well, they are calling my office, but they're also calling Dr. Spicer's office, and we have developed a form, and she can let you know a little bit about our initial intake as we're trying to hire all those people to do the work.
Right now, if somebody would like to call my office at 484-2230, we are taking their name and their number and just asking a few questions about some general questions.
484-2230. And as we wrap up this first segment, I want to thank all of you for being with us today, and we will be talking with Mr. Mort O'Sullivan and Ms. Jean Norman shortly.
WSRE's van has been wrapped with many of the favorite PBS characters that kids of all ages have come to know and love. This van is used by WSRE's production crew and can be seen at schools and community events. You may even see it when you're driving around the Gulf Coast region. It's a moving billboard for WSRE and a reminder that we're more than just TV. WSRE is your partner in education, helping our kids learn and grow. We're raising readers.
We continue our conversation on the Health Profession Opportunity Grant, which is a $8.5 million grant, and we're going to look this segment at the impact on our economy, the opportunities that it provides for our community, our associations with students, and how we will help them succeed in life. Here with us now is Ms. Jean Norman, who is president of the United Way of Escambia County, and Mr. Mort O'Sullivan, who is with O'Sullivan Creel and is the chair of Bay Area Works. We'll begin with you, Mr. O'Sullivan. Thank you for being with us, Mort.
Glad to be here, Patrice.
Talk to us a little bit about the economic impact that this $8.5 million grant is going to have, the difference it will make immediately and long term for the 5 years in our area.
When you take $8 million and put it to work in our community, first you get the immediate impact of those wages and salaries and those dollars circulating, but then the multiplier effect of all of that, it really mounts up. But more importantly is, what have you done with the money and what long-term benefits do you create from the changes that you've been able to make in this community? Jean pulled me aside 2 years ago, and she's very hard to say no to, and she told me about a wonderful idea that had come out of the Poverty Solutions team at United Way. There was a gentleman named Dave Phillips from Cincinnati, and 15 years ago he had started Cincinnati Works. There's nothing like it in the country. He had been a senior executive with Arthur Andersen in a worldwide position in that accounting firm. And when he retired, he lived in Cincinnati, and he wanted to turn and do something for the community. And he knew that poverty was a tremendous problem in Cincinnati, and the barriers that existed for people climbing out of poverty and finding sustainable employment to change their lives needed to be addressed. And so Jean should probably tell you more of the story as it went from there. But we've started a journey, and we are now the very fortunate beneficiary to be part of this grant, and I'll be happy to talk about that.
Wonderful. Ms. Norman, Jean?
Well, we are, as Mort was saying, we met Dave Phillips about 2.5 years ago and came to know him through the Poverty Solutions work. He is achieving just incredible results with entry-level, unskilled, chronically unemployed people in Cincinnati, and he is making all of that intellectual data that he has developed over the last 14 years since he and his wife Leanne established Cincinnati Works, available to communities like Escambia County and Santa Rosa County that he feels have the opportunities to succeed in replicating his program. And I think because of our work through the Poverty Solutions team and Unite Escambia over the last 4 years, that we have adopted the concepts of Bridges Out of Poverty, which is Ruby Payne's concepts about hidden rules and barriers to prevent people from becoming self-sufficient. And we truly are striving to incorporate those concepts in so many aspects of our nonprofit world, but also the business community. And Bay Area Works, or Cincinnati Works, in our form is Bay Area Works, is going to bring all of that together. The concepts of Bridges Out of Poverty, as well as the concepts of how to succeed in employment. Because we know there are 3 things that move people from poverty to self-sufficiency. Education, which Pensacola State is so exceptional at providing. Relationships, which this grant also is going to be providing. And then thirdly, employment, which also is going to be supported through the grant.
And that's, of course, very important for the economic impact that it would have over the next 5 years. Ms. Douma, as you look out over the 5 years, what kinds of disbursements, shall we say, will we be receiving each year? I think it starts with 1.6 million, yes, and incrementally.
Actually, 1.67 million this year, and that's the smallest amount of money we'll get over the 5-year period. I think the largest is 1.7 million. And I think what's important for us as we were developing this project is looking at who are our target population. And there are almost over 3,000, TANF recipients between Escambia and Santa Rosa County. And as far as other low-income individuals, which we're looking at the 200% of poverty level, in Escambia County it's 36.4% of the population actually are at that level. In Santa Rosa County it's a little bit less, 29.5%. And when we first were developing this project and we spoke with Jean, she shared a statistic with me, which I'm going to use it for every grant I write from now on, that it costs the government at least $30,000 a year to keep an individual on public assistance. So the dollars that we're going to be spending, which are also dollars that are going to be going into the community, whether it could be maybe a child care provider is going to be receiving dollars from a student that's being supported by the grant that now they can go to school because they're receiving funds to help them pay for child care. So those dollars are going to trickle on down to the child care provider, who will then have those dollars to supplement their income.
To Mr. O'Sullivan's point earlier, when he was talking about how it takes employment to, you know, impact our community right away. So we're going to see immediate impact. This starts in January, as I understand it. And I was looking at this editorial from the News Journal, and comment, if you will, I'm going to read a segment. It says that if the local economy is going to turn around, it will ride on the backs of people with the skills to fill good jobs. And in Northwest Florida, healthcare is a promising field for the future. And we were talking earlier about how, because we have that here, and that's one of our main industries, and it's a growth industry, and apparently predicted to become an even higher growth rate industry, I guess. Can you speak to that from your chamber experience and your community perspective?
We know in our community that tourism and the military each make up almost a third of our GNP, or gross national product as measured in our community. When you look to industry that we find throughout the Panhandle, you know there's not a lot of manufacturing here. It's never been here. But what we've become over time is a great healthcare center. And we've got 3 fine hospitals here in town that are constantly looking for staffing, and the nursing program finds jobs for everybody that comes out of that program. It's because of the reputation we've developed as a tertiary care center. So the future is very bright in healthcare. This grant will work very well to continue to promote what is already a strength in our community.
And of course, we know there's been a demand for healthcare professionals for many years. I think we've seen some statistics from the state of Florida where they've been looking for nurses, healthcare professionals, even physical therapy. I think there are needs there.
Yeah, it's all of our allied health programs which contribute to supporting the healthcare needs, radiography, actually even veterinarian technology is included in this grant.
Which is one of the new programs.
Yeah, that's one of the college's new programs. They'll be starting in January. Massage therapy is also included. So any of those programs that somehow support healthcare.
If you think about it, from an economic standpoint, we're going to help people be better educated. We're going to take people out of poverty. We're going to add to the glamour of one of our major industries. And I see all of those, better educated workforce, larger workforce in healthcare, as sort of helping us to attract other health-related industries. And so I think it's going to give us, from a bottom-up, sort of a rise in our competitive nature of being a healthcare provider for the region.
And I think with all the wraparound services that are provided through the grant, through Bay Area Works is just one of those services, recognizes that typically in entry-level positions, often the turnover rate can be as high as about 100%, really, even higher than that. And what we've seen, if we can provide the kind of support to help remove the barriers, whether it's mental health, whether it's transportation or child care, or fees for tuition, that people with coaching, with allies, with that kind of support, that they can be successful. And as has been demonstrated in Cincinnati Works, they achieve an annual retention rate of about 84%, which is 3 times the industry average. And that in itself is a great contribution to the bottom line for any employer who is hiring these individuals who come through this program with all these supports.
All boats rise together, and we have a rising tide.
Rising tide floats us all.
If you would like to talk a little bit more about your work with the Bay Area Works and your leadership and make an appeal perhaps for additional leaders, or do you have a wish list?
Over the year and a half that we've been working together, we've pulled people from social service agencies and business together. We've had a round table of 15 to 20 people. We did a study of the clients that would be coming to the organization, those seeking employment and don't know where to go. That survey revealed a lot to us, and then followed behind that was a survey of potential employers. And when we looked at the data from the two surveys, we realized that we have a model that will work, and that's why Dave Phillips was successful in Cincinnati. At Cincinnati Works, and granted that community is larger than ours, we don't expect to achieve the same numbers given our population size. But today, Cincinnati Works is bringing 700 people a year to employment. The cost of that program for each successful hire is under $3,000.
Really?
Now, when you compare that to the $30,000 a year in public assistance cost, we're making an impact on taxpayers and the business community as a whole. In Cincinnati, what has happened is the employers have been so happy with what has happened in the talent that's been brought to them, people willing to work, willing to learn, and wanting to advance, that they continually now are coming back. Those businesses are now contributors to Cincinnati Works because they realize that they get something out of this. It's not just an act of charity. So with that kind of success, our hope is after the third year, we hope to get off the ground in 2011. This grant is a big boost and a big kickstart for us. We're underway in our fundraising today. And as we get this off the ground, our hopes are at the end of the third year, we're at 150, perhaps 200 a year in people that we're able to place in jobs. And you keep piling that on with the retention rate that Gene talked about, we'll soon be making an impact in the poverty problem in our community.
Indeed we will. Any final words, Ms. Douma?
We're just very excited about this opportunity. It's the largest grant that we've received at the college, and the community cooperation and collaboration has been very fulfilling, I think, for us in seeing everybody work together.
Certainly, I can see how it'd be rewarding. Dr. Samuels?
Well, again, to echo what Debbie said, I think it puts all the pieces together. We've got the family services, the human services, the education, the workforce through Escambia, Bay Area Works, our partners, the hospitals, and so forth. I like to refer to this as one of those head and heart projects. From the head, it really makes sense to help people this way, and from the heart, you can't help but enjoy it.
Well, that concludes our program for today. Thank you for joining us on Pensacola State College Perspectives. We look forward to seeing you back with us next month when we'll talk about our collegiate high school.